My name is Rick Binder, and over the next few minutes, I'm going to be showing you how to best utilize the Binder lift on your patients. Its innovative design allows for easy and versatile application. However, a few basic principles on its use and safety should be observed. The Binder lift is not intended for the treatment of any patient illness or injury. It was specifically created to help you safely move your patients without causing harm to them or yourself. If you have any pre-existing injuries, you should consult your physician before using the Binder lift to help you manually lift a patient. The two most important things to remember when using the Binder lift is to team lift and to always use proper lifting posture. Now, let's get started. Ensure all buckles are unfastened before attempting to attach the Binder lift to your patient. Adjust the 3 torso straps to the approximate size of the patient. For smaller patients, it may be necessary to pass the male buckles through the loops located on the vertical column. For larger patients, simply lengthen each torso strap before attaching to the patient. Next, lengthen the leg straps to their full extension. You can attach the Binder lift to the patient using one of the following methods. The log roll method. Roll the patient onto their side and lay the Binder lift out with the cushioned edge in line with the patient's armpits. Bunch up the lift's side edge under the patient. Roll the patient back into the supine position. Pull the Binder lift underneath the patient until the leg strap receiver buckles are centered on the patient. The pull down method. Center the Binder lift just above the patient's head with the bottom edge of the lift touching the patient's head. Ask the patient to lift their head to allow the caregiver to pull the Binder lift down until the bottom edge of the Binder lift is bunched up just underneath the patient's shoulders. Firmly grasping the bunched up section, pull the Binder lift down until the cushioned edge is just underneath the patient's armpits. Seesaw action may be necessary. Ensure the leg strap receiver buckles are centered on the patient. The wrap method. Wrap the Binder lift around the patient with the cushioned top edge just below the patient's armpits. Ensure leg strap receiver buckles are centered on the patient. Once the Binder lift is in place, you will start with the top torso buckle and work down to the bottom, fastening each buckle securely, tightening each strap until taut. Rotate the harness left or right as needed so that the front 2 leg strap buckle receivers are spaced equally on the patient's waist. Because of the Binder lift's adjustability, this will be slightly different from patient to patient. Thread the leg straps under the back of the patient's knee and slide the strap up the inner thigh. Once all of the excess strap is pulled tight, attach to the front receiver buckles. Be sure the straps are snug, as any excess slack will result in the harness sliding up the patient's torso when the lift is executed. If the patient is in the sitting position, have them shift their body weight to the left while you snug the right leg strap. Then lean the patient to the right while securing the left leg strap. If the patient is lying in the supine position, slightly lift the patient's knee as necessary and thread the leg strap under the patient's thigh and adjust until snug. Leg strap extensions may be needed for individuals with overly large thighs. Simply buckle the 18-inch extensions into the existing leg straps and connect to the receiver buckle located on the harness. Recheck tension of each torso strap, ensuring each is taut, but not restricting patient's breathing. Once securely attached, grab any of the hand loops to execute the lifting process. Care should be taken to position your body as close to the patient as possible while keeping your back straight and arms as close to your body as possible. Utilize the strength in your legs, not your back, to accomplish the lifting. Partners of differing heights can utilize differing hand loop rows to allow for the offset of hand-arm elevation in the standing position. The taller person utilizes the upper row of hand loops, while the shorter person utilizes the lower row of hand loops. Unequal lifting can result in instability of the patient and could result in injury to the patient and/or caregivers. You are now ready to use the bender lift on your next call. For questions or concerns, please call 855-239-5438.